Hello, my name is Dr. Enya Vroom, and in this video we will review findings from our study that aim to learn what helps and what gets in the way of community organizations delivering recovery support services in Texas. We wanted to gain a better understanding of the recovery services landscape and explore the usefulness of quality improvement efforts and the supports needed to implement them. Over the last year, our team received research funding from the Institute for Integration of Medicine and Science at UT Health San Antonio that allowed us to talk with and visit organizations within the Be Well Texas Provider Network who are delivering recovery support services across Texas. We asked organizations how they would explain recovery support services to someone who was not familiar with them. Recovery services were described as a holistic, non-clinical, person-centered approach that assists individuals in navigating recovery. RSS participants are aided by peers with similar lived experiences. Peers serve as advocates to assist in getting the resources people need and to facilitate the achievement of goals through supportive and knowledgeable guidance and community connections. Organizations shared that recovery services have made significant progress over the last decade in Texas, especially in the last 5 years, due to policy changes enabling Medicaid reimbursement, increased collaboration with the criminal justice system, including partnerships with probation and specialty courts, and more targeted funding at state and local levels. However, buy-in from key partners, access to local funding, and resource availability varied by location, with geography often influencing community needs. Things that seemed to be working well included strong community outreach. Recovery organizations and peers excel in outreach, frequently participating in health fairs and community events to form meaningful and sustainable partnerships that support referrals and access to essential resources like bus passes, food, and clothing. Secondly, mentorship and consultation from entities like Achara, Be Well Texas, and the state have been valuable in providing guidance, resources, and training to enhance service delivery. Lastly, leadership plays a key role in supporting peers through providing professional development opportunities and mentorship. We also observed that thoughtful hiring practices and welcoming environments can help nurture positive team dynamics, and saw the importance of leaders who are familiar with peers' lived experiences, and when possible, match participants with peers who share similar backgrounds, as this can help with the navigation of services and foster strong, sustainable peer-participant relationships. We explored barriers at multiple organizational levels. At the participant level, we saw unmet basic needs, lack of transportation, and multi-layered stigma continue to affect service engagement. For peers, there is often limited understanding of their role, even in substance use treatment settings. This was attributed to a lack of knowledge about peer work, limited trust in peer training, and a broader misunderstanding of recovery. These factors can contribute to peer drift, where peers are assigned tasks outside the scope of recovery support. Peers are also dealing with high caseloads, leading to burnout, and often struggle with setting both personal and professional boundaries. At the organizational level, peer turnover, administrative burden, resource constraints, and concerns about sustainability were key challenges. Organizations also discussed strategies to overcome barriers. First, prioritizing the unique needs of their staff and communities by actively incorporating their feedback into decision-making plays a critical role in fostering buy-in, building community trust, and making peers feel valued. Educating peers, RSS participants, and the community about addiction, recovery, and available services also emerged as essential for gaining participant and community support, enhancing service quality, and supporting peer development. Frequently, organizations and peers are educating the community via outreach, emphasizing building trust and rapport through consistent visibility and presence. In some areas with high levels of mistrust, for example, rural areas, some organizations use community gatekeepers to help strengthen community trust with the organization. A recurring theme was peer burnout, often driven by peers not being able to see the positive impact of their work. Depending on available resources, many organizations address this by recognizing peers through monthly awards, appreciation events, and wellness activities, such as arts and craft days or hosting sober events. Finally, given the restrictions tied to many funding sources, for example, how grant dollars can be spent down, organizations have been creative in capitalizing and diversifying funding, such as becoming training entities or seeking philanthropic support. No organization reported relying on a single funding stream. Most operate with multiple sources, and sources varied significantly by geographic location. We also talked to organizations about quality improvement. which is a systematic approach using specific activities or methods to improve the quality of services in their delivery. Generally, organizations were supportive of quality improvement efforts, but expressed hesitation about increasing the workloads of already overburdened leadership and staff, and putting too much emphasis on documentation at the expense of building the critical peer-participant relationship, especially during intakes. Documentation was a common barrier, often cited as time-consuming, with many organizations also lacking formal systems for data collection. Supports needed for quality improvement efforts included training, developing approaches and tools that build on what already exists within the organizations, ensuring there is leadership buy-in to assist with championing the effort to increase success, and mentorship and technical assistance provided through academic partnerships with researchers like us. To recap, our study looked to explore the recovery support services landscape in Texas, focusing on challenges and strategies for service delivery. We also explored how useful and the supports needed for quality improvement efforts. Our future goal is to develop tools for quality improvement that are tailored to recovery organizations to ensure fit and practicality for real-world use. Our team would like to thank our study participants for their generous contributions to this project. Without them, this work would not have been possible. If you have any questions, please feel free to reach out at the email provided. Thank you for your time.